Hi, I'm Farah. So I am going to be administering medication to Miss Millie Larson. The first thing that I would want to do is to wash my hands. And I have the MAR with the name Millie Larson. I would knock on her door, introduce myself, let her know I'm Farah, I'm her nurse, and then that I'm going to be giving her her meds. I would ask her to state her name. She tells me Millie Larson. I would also ask her to state her date of birth. And she tells me 1/1/36. I would also look at the her name band, which it does say Millie Larson, and her date of birth does matches the MAR that says 1/1/36. I will let her know that she is due for Docosate, a stool softener, 100 milligrams. I've gathered all my supplies ahead of time, and that she's also due for her haloperidol, 2 milligrams. It's an intramuscular milligrams, IM. Just we like to say a calming medication, keep her calm, and it's 0.4 ml dose that she'll be getting. So I would get the Docosate, that's the first one, okay? And I would look at the medication. It does say Docosate 100 milligrams, expires October 2023, so I know it's not expired. And it does say Docosate 100 milligrams. I would put her in an upright position. I would put it in the cup. I would hand it to her. She's in an upright position. I give her her Docosate. She takes it. I give her the water. She swallows. I would encourage her to even drink even more, because her appetite's been poor, her intake's been poor, so I want her to drink as much as she can. So she takes it, she swallows, very good. And I put it there. And then I would let her know she is due for her haloperidol, and it is an injection. So I would get my gloves. This is more of an invasive procedure. Okay, so with my gloves, again, I'm going to look at her name band, and it does say Millie Larson, date of birth 1/1/36. So I've done a couple checks, making sure. I've looked at her wristband. I've looked at the MAR. I see that the med that's due is her haloperidol. I get the haloperidol, and I make sure that it does say haloperidol, and I look at the expiration date of the haloperidol, and it says June 2029, so I know that it's not expired. I also look at the MAR, and it says the haloperidol 2 milligrams, and I did the math, she's due for 0.4. I've checked, and I see that she has no allergies. And then I'm looking at the MAR, I'm looking at the vial haloperidol. I'm also going to check again her wristband, which is Millie Larson 1/1/36 for her date of birth, so I know I have the right patient according to the wristband and the MAR and the drug. So I would remove the cover, and I have my garbage easily accessible. I have my med cart, so I would put it in the garbage. My med cart is right there with my alcohol, and so I would get my alcohol, and I would make sure that I clean the vial real good. Okay, and I needed one more alcohol, which is right on my cart, my med cart. Okay, and then I would ask her to turn onto her side with her legs straight, if it's possible. Get my alcohol, the rest of my garbage, and then while she's on her side, I want to put my non-dominant hand on the area of the greater trochanter. I want to really spread my hands and really hold the skin so it's like taut, we call it. It's like stretches, okay? And then I want to just clean in the area where I will be administering the medication. So I want to clean it real good. And then I'm just going to leave the alcohol wipe just as a guide. I am going to be using a 3 milliliter needle. So I will get my needle prepared, and then it's actually a 22 gauge needle. The 3 ml was for the syringe. That's what I meant to say. Okay. And so what I'll do is attach, okay, remove the cap. I would put it in the garbage. I'm not gonna need that, okay. And then I would just make sure there's no air. And even while I'm doing that, I'm looking at the MAR, making sure that I am going to be given the haloperidol. And then I would get rid of any air. And I would put the needle, because I already cleaned it, in the vial. And then I would pull 0.4, not a lot, pull the 0.4, okay. And then I've cleansed it. I want to put my hand again, the non-dominant hand, hold it taut, and it's going to be a 90 degree. I'm looking at her wristband, and I see Millie Larson, date of birth 1/1/36. And so I would just all the way down, okay. And just a little pinch will let her know. Then I would aspirate. I see no blood, so we're good. Continue. And then I would remove the needle, put on the safety, discard it immediately, and then I would just rub it a little to massage it. You're in the hospital and alone, you need a little TLC. I just want to let her know that I'm sorry if it hurt. Then I would just, after I do the alcohol, I would get my Band-Aid. I would open it, and then I would put it, cover the area, and then I would discard any gloves and everything in the garbage, okay. And then I would clean my hands. After I remove gloves, I always want to clean my hands, okay. And then I would make sure she's in a nice, comfortable position, and the head of the bed, elevated if she wants, or she can lay in a comfortable position. She has the call light, so she's good to go. All right, so I spent a little extra time with Miss Millie, but she did have her meds, and ask her if she needs anything else, and if not, then that's it. We're good. Bye.